Hello, my name is Mackenzie Oliver. I am a third-year doctoral occupational therapy student at The Ohio State University. My research and doctoral experience were centered on the reduction of cancer-related fatigue through physical activity engagement. First and foremost, the scoping review was completed according to the preferred reporting items for systematic reviews, or PRISMA, to answer the following question. In adults, what interventions within the scope of practice of occupational therapy reduce the negative effects of cancer-related fatigue syndrome? Based on the extent of available evidence, the search terms utilized for each database, CINAHL and PubMed, differed. In a general sense, the search terms included adults, occupational therapy, cancer, cancer-related fatigue, best practices, and improved quality of life. The scoping review process is depicted by the created PRISMA diagram. 265 studies were originally imported for screening, with 2 duplicates removed. 263 articles were screened based on the following established inclusion and exclusion criteria. Inclusion criteria: adult population with a diagnosis of cancer, intervention for cancer-related fatigue with a desired outcome, and services a generalist OT can provide. Exclusion criteria: children and adolescent populations, interventions outside the scope of occupational therapy, including diet in respect to nutrition, as well as dietetics-based intervention, and medical or pharmaceutical procedures. 244 studies were deemed irrelevant, 19 full text reviews were completed, and 14 studies were excluded. 5 studies were ultimately included in the scoping review. A visual representation of the scoping review findings was created as a reference for other researchers and clinicians seeking evidence-based interventions to reduce cancer-related fatigue. 2 main themes were devised based on the included 5 studies: patient education specific to exercise and physical activity, more specifically cardio only or strength and cardio. 1 article focused on patient education specific to exercise, and 4 articles targeted interventions focused on physical activity. More specifically, of the 4 physical activity intervention studies, 2 incorporated engagement in high-intensity interval training, and 2 devised an intervention focused on scheduled walking. Based on thorough analysis of the included studies, there is an increased breadth of available evidence to support the reduction of cancer-related fatigue through patient engagement and physical activity. The combination of strength and cardio-based physical activity is most efficacious to target fatigue symptom reduction and overall improve patient quality of life. Overall, the findings from the completed scoping review highlight an increased prevalence of evidence-based practice to support clinician use of physical activity intervention for cancer-related fatigue reduction within the adult oncology population. There is a direct parallel between cancer-related fatigue mitigation interventions and the occupational therapy scope of practice. Reduction of cancer-related fatigue through patient physical activity participation results in patient improvement or maintenance of health status and overall life satisfaction, in turn resulting in patient return to engagement in daily roles and routines with independence. Lastly, through patient and caregiver education, there is promotion of increased patient safety and occupational performance, as well as there is potential for physical activity incorporation in a patient's daily routine. I completed my doctoral experience at the James Cancer Hospital and Solove Research Institute. The James is a 21-floor inpatient comprehensive cancer center with 356 beds and is recognized as the third largest cancer hospital in the nation. A comprehensive cancer center is defined as a cancer research center that gets support from the National Cancer Institute to do cancer research and provide services directly to cancer patients. Each of the 21 floors of the James specializes in a specific type of cancer. Thus, the organizational structure of the therapy department involves teams designated to evaluation and treatment of certain cancers. Over the course of my 14 weeks spent at the James, my role as a doctoral student involved the following: to gain the skills and competency of an entry-level practicing clinician, to evaluate and to treat the adult oncology population, and to implement evidence-based practice to reduce cancer-related fatigue through a developed clinical guideline and catered patient treatment. Based on clinician interest, I completed an additional scoping review focused on mindfulness and stress reduction therapeutic activity in the adult oncology population. I designed a PowerPoint to share with occupational therapists at the James. With respect to professional leadership, I had the opportunity to work alongside the Associate Director of Rehabilitation Services at the James, as well as the Quality Assurance and Evidence-Based Practice Team Lead at the James. I created and disseminated an electronic survey to establish needs of practicing clinicians for future clinical guideline development. I then analyzed the survey results to decipher the most prominent areas of importance to begin the clinical guideline development process to ultimately optimize patient care. Last but not least, I created the depicted clinical algorithm, which is the program that I identified based on evidence as most efficacious for cancer-related fatigue reduction within the adult oncology population. More specifically, the algorithm is a step-by-step guide for clinicians to utilize to determine if a patient can safely engage in the evidence-based strength and cardiophysical activity intervention. A high-level overview of key stakeholders was conducted via distribution of an 8-question electronic survey to better understand current customary approaches utilized for cancer-related fatigue syndrome mitigation, as well as feedback was obtained regarding the appropriateness, acceptability, and feasibility for adoption of the clinical algorithm at The Ohio State University Wexner Medical Center acute care and outpatient facilities, including Stephanie Spielman. With respect to the survey that I created, questions were centered on demographic, for therapists to indicate their discipline, practice site, and number of years of practice, current practice treatment plan for cancer-related fatigue reduction. The created clinical algorithm was included and shared in the survey for clinicians to determine the feasibility of adoption at their specific settings, as well as implementation barriers present at their sites. Thus, both occupational and physical therapists comprised the survey sample. There were 15 OTPT respondents from Ohio State acute care and outpatient settings. Based on a thorough analysis of the survey results, the acute care findings are as follows. Initiation of the clinical algorithm was deemed not feasible. Barriers are foreseen with adoption of the clinical algorithm at pertaining sites. I believe potential limitations for adoption of the developed clinical algorithm in the acute care setting involve the nature of acute care as well as the critically ill health status of the patients. The patients are also not admitted in the hospital for a long enough duration to participate in the evidence-based intervention, as well as the patients do not have the endurance capacity for safe engagement, further emphasizing the lack of feasibility of implementation of the clinical algorithm in the acute care setting. On the other hand, the outpatient results are as follows. All respondents were in agreement on feasibility of clinical algorithm adoption. In conclusion, the primary takeaway focuses on the appropriateness, acceptability, and feasibility of targeting the clinical algorithm fully in the outpatient and/or follow-up clinic settings. Based on the clinical algorithm, for patients that are deemed appropriate for strength and cardio physical activity participation, with respect to the next steps, additional exercise recommendations can be advised for patient continued strength and cardio physical activity engagement post-discharge as a home exercise program. As I reflect on my doctoral experience, I am grateful for the opportunity to grow as a clinician and to learn from medical professionals at a nationally ranked comprehensive cancer center. I look forward to continuing to cultivate my therapeutic skills as well as continuing to engage in further research opportunities within the professional world. Thank you for listening.